We have a guest up here that I'm interested to talk to because of two things. One, he is the former DuPage County Commissioner. He ran a re-election campaign, which was a very close race, a lot of money spent. But as we know, DuPage County is increasingly going blue because what happened in the pandemic is a lot of people lived in Chicago, wanted to move out to places where there were yards so their kids could kibitz and play.
Yeah.
But they brought their voting ways with them. And I'm just here to say that we in the suburbs do not like that.
Nope.
His name is Greg Hart, served as the co-chair of the HOPE Task Force. That's Heroin, Opioid Prevention, and Education. Greg, welcome to WLS, sir. Good morning.
Good morning, Ray. Thank you for having me. It's a pleasure to be with you and Jane.
Well, I tell you, it's an important thing. We've talked about this a lot. It seems like in the last 20 years, this has been going and going and going. What do we do when we see what's going on, not only in Chicago with the fentanyl, with the opioid, with the heroin, and then it gets out to the collar counties, and it seems to me we always recognize a problem once it gets out to those beautiful green grass suburbs. Where are we at with this deal right now, and how is it trending?
Well, Ray, we're coming off of the most deadly year nationally for opioid overdoses across the country. And unfortunately, I'm really sad to say our region as a whole, Chicagoland, both the city and the suburbs, are not immune from this trend. You saw just last week, Cook County announcing that they had 2,000 opioid overdoses in 2022, a new record year for them. Out in the city of Naperville, which straddles both DuPage and Will counties, the numbers are no different. They just announced last week as well that opioid overdoses and just broader substance use overdoses this year are more than doubled in 2023 from 2022, and we're only two-thirds through the year. So unfortunately, we're approaching that grim reality that all of us, regardless of whether we live in the city or the suburbs, are likely only 1 degree of separation away from someone personally impacted by an overdose.
Certainly seems that with the things that are going on in our world, with everybody fighting amongst each other and violence and carjackings and gun crimes, sometimes we take our eye off this other ball. We're speaking with Greg Hart. He is served as the co-chair of HOPE. That's the Heroin, Opioid Prevention, and Education Task Force. Jane.
Greg, thank you so much for what you do. I think a lot of people have been affected by loved ones who have overdosed. I have 3 people in my life that have overdosed. And it's not a place that I want to live or be in. And unfortunately, you just told us the numbers and they're rising. I'm assuming that after there is an overdose, you do research and you are checking for patterns and to see what's trending and what's happening. Can you shed some light on any of the patterns in drug abuse that may have caught your attention as these numbers are surging?
Yes, absolutely. And one of the trends that I think is the most noteworthy one is one that Ray mentioned at the onset of this segment, which is the rise of fentanyl. It's something that we continue to see, the synthetic opioid that's 50 times more potent than heroin and 100 times stronger than morphine. And if you look at Cook County's numbers, Jane, 91% of the opioid overdose deaths that they reported involved fentanyl. The same thing is occurring in Naperville, DuPage County, Will County, and throughout the collar counties. And I think if you look at that, the trends that we're trying to glean, that is probably the most noteworthy one. And it's particularly the most dangerous because what we're seeing is that users don't even know they're taking fentanyl when they're overdosing from it. And it's being mixed with substances that, historically have not been viewed as causing overdoses, such as cocaine, for example, marijuana, and that's what makes that increasingly dangerous. There are other trends that I think are important to note. For example, in DuPage County's numbers from 2022, we saw a shift in the demographics of people that have been impacted, and we saw this in Cook County as well. The opioid epidemic has this false perception of being a condition that only affects white men in their 20s and 30s. But if you look at DuPage, we actually saw the number of overdoses occurring in ages 18 and below increasing for the 3rd year in a row. Cook County, in their numbers that they released on Friday, showed that 50% of those impacted by an overdose in Cook County were African American. So this is a broad problem affecting all of society, and the sooner that we recognize that, we'll be better off.
This is Greg Hart. He served as a co-chair of the HOPE Task Force, opioids, drug addiction, things like that he tried to tackle. There's so many things I want to ask you. I'm sorry if this question comes at you too fast and furious, but one, what amount of these drugs are coming over our border? And then two, how many of these problems stem from people that get injured and they get overprescribed, and all of a sudden, boom, here we are. We have a problem, because that's prevalent in this problem too.
It absolutely is. And if you look at when this problem started in our society, going back 10 years ago, I remember when I first was elected to the DuPage County Board in 2017, we had already been addressing the opioid crisis for a couple of years at that point. And one consistent factor that we heard was that many people who had begun their addiction with opioids started through a prescription that was legally and properly obtained due to an injury. And I think that's why you see, if you look across the country, a lot of the regions outside of Chicagoland that have been really acutely impacted, Appalachia, the Northeast, a lot of these communities historically were blue-collar, working-class communities where a lot of people use their hands for work day to day. And if there were an injury to occur, and they were prescribed an opioid, because of the way that the pills were prescribed at that time, in some cases unethically, it often caused people to get addicted to these substances. And, the unfortunate reality is we're paying for that price still today.
Where do we send people for information if they know somebody that they think might be starting to have a problem with this? If they see somebody struggling, where do we send them?
Well, what we have to do is we have to normalize and destigmatize treatment. I think every community across Chicagoland has treatment options for both mental health and substance use disorder, and oftentimes, Ray, those conditions are linked. But the sad reality is that we have a lot more work to do. I know in DuPage County, for example, when I was the co-chair, one thing I really tried to do was expand treatment options in our community. I saw data that showed that more than 2,000 young people from DuPage County had to commute to the city of Chicago for inpatient treatment options. And that, to me, was unacceptable. And that's something that's occurring nationwide, but especially in Chicagoland, where we don't have the supply to keep up for demand for treatment. Another thing that we have to do is we need to think innovatively about this topic. I saw data in my role that showed that one of the best predictors of someone's success in treatment was their employment status, whether or not they had a job. So we created programs that would connect people who were showing success in drug treatment to an advanced manufacturing certificate from the College of DuPage, and then a full-time or part-time employment opportunity with a DuPage-based employer. We graduated 3 classes of that program, and I'm proud to say that it had a real positive impact on many people struggling with addiction. But I think ultimately the main focus needs to be on saving lives. I was just at an event this past weekend in Carroll Stream, hosted by a great organization called My Child's Life Matters, made up of moms and dads who have lost their sons and daughters at young ages due to fentanyl. And one consistent theme I heard at that event was that my child made a decision to get high. He or she didn't make a decision to die. And that's why I think expanding naloxone, Narcan, and fentanyl trust strips, where people who are going to use drugs, and oftentimes we can't stop someone from using, but we can help them stop, making sure that it's laced with fentanyl. And I think keeping people alive and saving lives should be our primary focus.
Hey, Greg, I want to hold you just I want to hold you over here for just a second, because this is an important topic. And two, there's something else I want to ask you about, because during your time as Cook or as DuPage County Board Commissioner, you were one of the most bipartisan guys out there. You reached across the aisles, and I have another question for you. I seldom do this, but I want to hold you over for just a second, okay, pal? Bringing back our guest, kind of holding him over. This is Greg Hart. He is the former DuPage County Commissioner. We just talked about opioids and things like that. We will put links and resources up on all our social medias and on the website here, WLSAM.com.
Because whether it affected you or not, it's still important to talk about.
And you never know. You never know when it might happen to you. You just don't know. But Greg, I want to talk to you about something that, because you're a young guy. I think, what are you, 35 years old? You are the former DuPage County Commissioner. You are the guy that's out there, that's the new blood in politics that we need to see. And the question I wanted to ask you before we went to break is this. We've seen cognitive decline in Joe Biden. We know that. We've seen it in Mitch McConnell. We've seen it last week on the floor with the Dianne Feinstein when they came to her to vote. All she had to do was say aye, and she went into a rant. Where do we go? Do you think that maybe there's not only term limits but age limits on politicians in our country?
Well, I think if you look at where American society is at right now, you would see broad support for the idea that a new generation does need to take over. I saw a poll recently asked among Americans nationwide about the 2024 presidential election, assuming that the two choices are President Biden and former President Trump. And obviously, if you look at polls, that's what it's looking like today. In that case of that matchup, more than 50% of Americans, and that cuts across Republicans, Democrats, and independents, would vote or look at voting for a third option. And I think that indicates that the candidates that we're putting up nationally for offices beyond just the presidency really are not reflective of the country as a whole. In this coming presidential election, you're going to be seeing the electorate made up with a plurality of millennials and younger, which is something remarkable. And I think if you look at the choices that we have, there's no doubt that Americans, if you were to ask them today, would like to see a new generation take the reins and run. You know, Ray, you asked me what we can do about that. The reality is when I ran for DuPage County Commissioner, I was the first millennial elected to a full 4-year term. And the reality was that I had to kind of charge through the door. No one opened it for me, so to speak. So candidates that have an interest that are of a younger generation, the advice that I would impart is that no one's going to give them the opportunity. They have to go and take it. And we really need to start seeing candidates that are really representative of the electorate as a whole starting to run.
The funny thing is, too, when he was elected, he was still living at home with his mom. I kid. I kid. You know, I kid. This is Greg Hart, former DuPage County Commissioner. Jane.
Well, Greg, it's interesting. You said it. You were the first millennial elected to a full 4-year term. How did you get interested in politics? It was because you just wanted to see a change, or was there something driving you from a younger age that you wanted to do this? And then secondly, if there are the younger generation that wants to get involved, and you said, they just got to go grab it. It's easier said than done. Do they call you? Do they get mentored? Like, where does that come from?
Well, I was blessed with a lot of mentors that helped me think through that decision. And yes, we're supportive of my getting into politics. And, you know, I never thought I would run as early as I did. I had always been someone who was civically engaged and active and interested. You know, I served on the board of a charter school, for example, and got my feet wet doing that. But the reality is I decided to run because I looked at the makeup of my own county board. I'm a third-generation DuPage County resident. I love this community. And I looked at the board, and a lot of what the board was doing at the time was trying to save money by consolidating government services to, basically reduce the cost but increase the efficiency of the services that they were providing. I'm a management consultant in my day job. I do that for private sector organizations on a day-to-day basis. And I thought to myself, well, if this is what the board's focusing on and I have more experience at age 30 than anyone on the board does on that subject matter, why not throw my hat in the ring? And I think this is a broader issue with younger people in general. They often know more than they think they know, and they have more to add than they think they can. And getting that out of your mind that you are too young, I think that's something that's instilled in a lot of people. That's the first step. Not paying attention to the age. Pay attention to what you think you can provide in terms of value. And my guess is that if young people across this country take that mentality, take that approach, and if they're interested in public service, they will probably likely run at more higher rates than we're seeing today.
Greg Hart, man, I appreciate you. You speak on good topics, and we'll have you back, okay?
Thanks, Greg.
I look forward to it. Thank you both so much.
That is a former DuPage County Commissioner Greg Hart.